2 seconds. Mm-mm-mm.
Um, just invited Danielle in here. So, uh, today, it's pretty important, because this live for me is dope because, it allows, me to give you all some insight into I won't say the hardest case of my entire career, but only as it pertains to fibroid surgery and preserving someone's uterus. Um, this took me to the limits of my patience and and skill level. Like it was some very trying times with this surgery. Um, but I don't want to talk to you all too much. I want you guys to listen to um, to Danielle, who's my patient, who went through this whole thing. So which is why I'm doing this today. See if I get her. So she kind of like Cola, where she is really new to IG, to be honest with you. So she I gotta get her on here, but I'm work on it. Hold on. I know she up here trying to figure out. We should have did a dry run before we got on here. She said she had it, but we'll see about that. Um, but yeah, I want to give you guys just let you hear her story because um wait, let me get in from my personal page. So, the thing about it is what really bothers me, and some of you guys do it without really understanding the impact of words. Words are very powerful. Words really uh, change perspectives, and they hurt people, and they hurt emotions, and they're really devastating. But to that point, when I hear, um, how did she let it get that bad? How was she, you're faulting her, shaming, these women with advanced fibroid disease because you just don't understand the world that they're in. Um, and for women with advanced fibroid disease, it's like a community within the community. For one, you got fibroids, and then you have women with advanced fibroid disease. And for those women, the, the emotional impact that it has on their lives is you just really can't understand it unless you're actually in it and you experience it. Um, and to that point, to say things like, how did it's not a choice. It's not something that a woman chooses to have these big growths in her belly. But when you go from doctor to doctor to doctor, and they tell you, you're going to have, horrible disfiguring surgeries, and you have absolutely no chance of preserving your uterus, and you're faced with, you know, do or die type things, like it makes you think twice before, just trusting somebody with your life. So I am so very thankful, that she trusted me to do this for her, but she waited. She's gonna talk about how she waited uh, a decade, um, to really find me. But if I could get her on here, come on, I knew this was gonna be an issue because. Uh, so I'm praying to goodness that she hop herself on here. Um, She's here, but her name is Danielle Cross Carter. That's her tag. So if y'all can tag her, because if I try to go off and text her or do whatever, it's gonna kick out the live. So I may have to do that and call her to kind of walk her in here. So if I have to do that, then we could get right back on here. But this is something you guys do not want to miss. Like it is. I've been doing this for 14 years. I started residency in really I started my residency in 2008. I did a year of general surgery, but for straight OBGYN, I've been doing that since 2009. And since 2009 till now, uh, this has been one of the most remarkable, cases that I've seen. You know, definitely from a fibroid standpoint, I haven't seen anything like this. Um, and it's just like I was just blessed to get the opportunity to actually take the case. That's how I look. Yeah, that's Danielle Cross Carter. That's her. I just can't get her on here. Mm, I knew she was gonna have issues. I'm trying again. And it say she looking. She don't even she po thing. Po baby. Oh, did she join? Wait, Danielle. There she go. Hold on. She joined, but now I gotta get her on here. So now you got to get on here. So when I invite you, just accept the invite, or just look at that bottom button. So if you're on here, Danielle, like look at the bottom where you see the plus sign with the camera. Hit that, and it's going to request the invite, and then I'll let you on. Because I'm just talking at this point. I'm not this ain't my show. This your show. Everybody want to hear you. They don't want to hear me. But I'm here. How are you? No, you're not here. You got to come on here with me. Mama, damn, you got to come on here with me. Push the little plus at the bottom, the but with the camera and the plus, so I can just request you. I'm trying to get you in here. She talking about I'm here. She my age. I'm gonna talk to her like, here we go. Wait a minute. Let's see. No, I want to let y'all on to ask questions. If she can't get on here, I'll let y'all come and ask questions. But I'm trying to get her on here. That's the whole point of this live, because I want her to be able to tell her story, and you guys need to hear her story. Where'd she go? Hold on. Somebody in there. Wait, I was on my computer. Don't get on your computer. Get on your phone. Yes, jump to your phone. Go on your phone, please. I'm just looking at here. Get on your phone. Thank y'all for being patient. Bless her little sweetheart. You know, she my age, but in this technology game, she like it's like talking to my mama. Here we go. Look at God. Come on, Daniel. She come on. Hold up. Accept. Trying to accept her in here. Now it's gonna be IG not letting us be great. I didn't accepted her multiple times. It's not letting me great. Come on, IG. It ain't letting us be great. All right. I'll divert. If she can't get on here, then I'll have Cola hop on here and we can at least just run our regular live, and then I'll try to incorporate her in here at some point. I don't want to waste you guys' time. I want you guys to get something out of every time I come on this IG live. They let foolishness connect. Oh yeah, they let foolishness. So it happens all the time. But the whole point was for y'all to hear this woman is so remarkable. Um, yeah, she was on her PC. Po thing, po child. But she trying to get on now. She on her phone. Oh Lord Jesus, Lord
Okay,
Jesus,
can you see me now?
Jesus,
Yes.
Jesus. Look at God. Look at it. Look at it. Won't He do it?
I'm here.
Look at
Like,
it.
come on.
Oh my
Exactly.
Jesus.
Yeah.
My God.
Hello,
Oh,
everyone.
oh Lord.
Thank you so much for, you all. Yeah, I'm not that bad, Doc P. I was on my computer. I guess you got to use IG on your phone. Now, hello, everyone. Doc P has been talking. I'm going to go ahead. That's me that you all have been seeing. The videos. I'm truly, thank you, Dr. P, for taking my case. Um, it was a pleasure.
Facilitate. I'm gonna be Cola today, and you Doc P.
Okay.
So I'm just gonna just toss it up here. So, um, talk to so everybody has saw it. So if anybody that's coming on new and don't really realize it, Danielle is a patient of mine that again has probably the most impressive fibroid cases that I've seen personally. And I'm as a fibroid expert that sees advanced fibroid disease, she has been my most impressive case, not just for the size of it, but what the fibroid actually did to her body. So with that, tell us a little bit about uh, just like your journey and your struggles early on when you first noticed a fibroid and how that impacted your life years back.
Yeah. So I noticed it. It's been, it's been a little over 10 years, but
Mhm.
the key takeaway definitely for everyone is when you notice weird things, definitely touch base with your physician. I think it was probably years before then, where I would get my annual PAP exams, and they would notice, the doctors, they would say, "Oh, I can't really, I would have to navigate to find your cervix, for example, and it's over to the left."
Mhm.
Things like that, you should definitely get further investigation because that's not normal. But I just, well, I don't know per se, but it pretty much over 10 years ago, I noticed pain um, one day at work, and I wasn't even on my menstrual. It was when I would say menstrual cramps, but it was probably on a million, something that I
Mhm.
never experienced before. So much so that my body just went crazy, nausea,
Mhm.
vomiting. Um, so I knew at that point, okay, I think it's something going on with my uterus. Went to the doctor. They did an ultrasound, found out that I had fibroids. So at that point in time, they weren't the one. It wasn't small, but it wasn't huge. I wasn't having the typical symptoms that most women have. I was having regular menstrual cycles. I mean, sometimes I would have menstruals where, okay, it would be I would have menstrual cramps, but the only thing that I noticed was, okay, the frequency and urination
So
for me.
tell everybody when the first time you felt the actual lump. So they got the ultrasound maybe about 10 years ago. You start to feel those symptoms. When was the first time you felt on your belly and it was like, oh wow, I feel a lump there?
Oh, the actual, yeah, that's been about 10 years where
It's
I
still 10
started
years.
getting
Okay.
those bulk symptoms where
Right.
I started adjusting how I dress because I noticed the bulge slowly.
Gotcha.
Hmm.
So when when did it get to the point where you were like, oh, I have to do something about this. This is not normal. I have to like figure out some surgical options or figure out an option to treat it. When was that?
Yes, because once it started growing, now for me, Um, it I'm a unique case in the sense that my fibroids just started growing out of nowhere, as it was the slow progression, but then it was about maybe about 8 years at that point where I would say, okay, I was trying to find options. They pretty much, I decided to wait, but then I said, okay, I'm having bulk symptoms. Let me take this a little bit more seriously. However, it was around the time my mom was dying. It was, I mean, I'm talking about the most stressful period of my life, and that it just went crazy, so much so I was at the hospital with my mom, and the doctors, when
And
they
when
did their
what
rounds,
year
they asked, was I pregnant?
what year was that, Danielle, when
um
that happened?
that was 2016.
Okay. And so and so 2016 it started to get bad. Trying to figure out like, okay, what are my options? You don't have any children. And I'm trying to paint the picture because like I was saying before you got on, what really it aggravates me, but it's hurtful for you all because I know what you go through. What's really aggravating is when people, and I've had women with advanced fibroid disease themselves with bad fibroids and say, how did she let it get like that? I'm like, you already bad. So how, paint the picture and tell people like how that impacts you uh when people like assume that you've just kind of been negligent, and explain to people why you had to wait, why you chose to not deal with it right away.
Yes. So initially, yes, I had life, work. It was just different things going on. I wasn't ready at the time. I thought I had time to wait, right?
Hmm.
I didn't think the fibroids would grow that fast.
Hmm.
Um, then on top of that, once um I couldn't help it. It's not that I waited. I still was getting checkups, etc. But like I was saying, I wasn't having the typical symptoms where it was totally terrible. It was just okay. Now my stomach, I'm getting a bulge. Um, in between that time, the fibroid grew. So that's
And what
where I
and
started
how
with the multiple doctors. Where I
where did how long would you say it went from like something that you could feel bulge to the point where it was like, oh my God, I'm everybody saying I'm pregnant? How long would you say that time frame was?
it was maybe about a year.
Yeah.
Yeah,
Mm.
if that,
Right.
like it just went overnight,
Right.
just went to another
The
stratosphere.
level.
And
And
that's
for
where,
yeah.
yeah,
It,
from there where I am stuck now.
mhm.
And when I go to multiple doctors, because for you all, just for you all's reference, um, Dr. P is physician number 10 for me, just for you
Mhm.
all's reference. I'm from Pennsylvania. I've been to prestigious
You can name them.
universities.
You can put them out.
Oh,
You
I
can
can
put them
name
out
them
there.
on the
You
line.
you can name them. You can
Okay.
name them. You can name
Okay.
them. Yeah,
Oh,
talk
I
that
mean,
shit.
I went
Yeah,
to
you good.
Johns Hopkins. I went to Thomas Jefferson. I went to a smaller hospital here for us, but Albert Einstein. I even a physician in California, San Diego. I think it's USSD. I can't remember the name, but every time I would go to see every physician, it was automatic hysterectomy. That was devastating for me because now, mind you, it just grew. And then that was about the time where I'm married. All right, I need to stop playing around, start trying to figure this out. I want to have children. I want to have children.
Right.
But every single doctor is telling me hysterectomy.
But
And
not only hysterectomy, they
oh,
told you vertical incision too,
yeah, the
correct?
vertical incision. There's no way they can get it out with what is it? The
The horizontal.
transverse, the
Yeah.
horizontal. Definitely what was it? Midline. I mean, one physician, I just didn't trust the doctors. For me, I just was doing research. I was reading medical journals where I saw people were taking out large fibroids. So
Hmm.
that just had me believe that, okay, I know I can't, I don't know the physician yet, but I'm going to keep trying. But during that time, yes, it was a substantial jump, but then the fibroid kept growing.
Yeah. And that's the point that I want to make to everyone. It's the only difference between a woman with no fibroids versus a woman with multiple small fibroids versus large fibroids is there's really no difference, because the patients that I see that have advanced fibroid disease, and Q, who's a patient that had the 17.5 pound fibroid, can speak on this as well. It grows quickly. Why it does that, I have no idea. We don't have any idea. But for patients that are in Danielle's category, where it's advanced and it gets like that, it's not like it takes years and years and years. For whatever reason, it grows quickly, very quickly, to where it's like, now it's here, and now you're searching for answers, and now you're kind of stuck in the situation. And I want you to speak on Danielle, because everyone has it in their mind, like, oh, she had to be eating meat, oh, she had to be eating horrible, and her diet is bad, and she didn't exercise or whatever. So let's talk about like your lifestyle and how you eat, because I know how you do it, but let's talk
Yeah.
about that and how it relates to the growth of your fibroid.
Yes. So for you all's reference, I eat all organic. I don't even play around. If you know me and you're on the live, people are always talking about how I eat. I eat all organic. I even at one point I wasn't eating any meat and it still was growing. I eat a lot of fruits and vegetables, beans, rice, where you would say basic food. I don't eat out a lot. I have a very, very simple diet. That did not matter in my case.
Talk about, like, because yours was so was different. Talk about the impact that once it grew so big, how that impacted your body, like
Mhm.
what made your case so different and what you had to go through.
Yes, because it was one thing you all, okay, they were saying hysterectomy, but I would just hit different hurdles just because of other health issues. So the fibroids growing. By the time I was at the end, I couldn't stand up more than an hour. I would have pain in my left leg, all my ligaments in the front for my stomach, like holding up the fibroid. Um, at that point, yeah, having to go to the bathroom uh all the time. And then I actually, you all, I had decided, I was like, you know what, maybe I just have to submit and get this hysterectomy, right? Because it was just, I could not find anyone. Like I said, I'm going to doctor after doctor. It is exhausting, you all. Like, I mean, just utterly exhausting. They tell you the same thing over and over. And then to add insult to injury, I even went to see IVF specialists. I saw about 3 IVF specialists. And
It's okay, baby.
um,
You all right?
they,
It's okay.
yeah, I saw 3 IVF specialists and they would not perform, they wouldn't do an egg extraction. They said I had to get rid of the fibroid in order for them to um
Do anything.
but do anything. So I was in total purgatory, total purgatory. Then, okay, oh, just add icing on the cake here at this point, which I think it saved me though, which is strange. The fibroid, because it was so massive and took up my whole abdominal cavity, it caused a pleural effusion, which for you all that don't know, a pleural effusion is your lung sits inside a cavity, and
Mm.
it inflates, deflates, and it has a certain amount of space. It's free to deflate, inflate. Oh, hopefully I said that right. But the fibroid, it was so much fluid in my abdomen. And as Dr. Pete said, it was sitting on my inferior vena cava, an artery. Is
Right,
that an artery?
right. It's a
And
vein.
yes, a vein. And it was pushing the fluid up into my one of the cavities of my lungs. So I started having shortness of breath. I can't walk for a while. They would have to complete a procedure called the thoracentesis, where they would stick a tube in my back and pull the fluid. So for you all's reference, I had that procedure, goodness, probably about 6 times.
Yeah,
Each time they would do it, they would pull out about 2 liters. For you all's reference, 2 liters is about 8 cups.
yeah.
A little bit over 8 cups. That's about 4 pounds. The highest amount where I could not get rid of it. Every time they would pull it out, it would come right back. So
So
I
let
was
me
going
let me
through that cycle, and then I still couldn't have surgery at that point because we had to figure out, well, what is the cause? Like, isn't truly rule out every other medical condition before I get sent for surgery. Make sure it's just no cancer, nothing, right?
so
That I'm
I'm gonna play.
healthy.
Let me add to that. So when Danielle first initially consulted with me, she was nervous, and we were having a conversation. It was a virtual consultation, and then when I saw her, I was like, oh, that's impressive. And in my mind, I'm like, okay, well, it's something that we can get through. This is an impressive thing we can get through. When she actually, so to her credit, she knew how bad things were. And she's like, nah, I'm not just gonna show up on surgery day. You gotta see me. You gotta see me. You gotta see what this is so that we can truly have a conversation about things. And I really appreciate you for doing that.
And
So
can
she
I
she
just
she flew.
add, Dr. P is in the point, because this is going to be a tidbit for you all when we get to the surgery. Definitely a part of that was the doctors, because I have been to so many doctors. They just talked about how vascular this fibroid was. And
Hmm.
that's why my husband and I, we came in person. Hi, Dr. P, we need you to really see this in the flesh. Even coming
Absolutely.
through your airport,
Facts.
they were like, "Oh, what you do?" I had a surgery date, so
Hmm.
yeah. At this point, people would say talk about pregnancy so much
Every that
where
it was
I
just like normal,
yeah.
and that's crazy. So when she came, it was like, okay, we had this conversation, but what started to happen, so to her point about these pleural effusions, is that when her mass got so big that it started to put pressure on the large vein that drains all of the blood back to the lung. It's called the inferior vena cava. So you have two really major vessels in your body. You have the aorta, which comes from your heart, that basically comes down and then branches off to all of your other to your limbs, your extremities, your toes, your fingers, and then it distributes the blood. But then everything collects, like all of the waste products, all of the carbon dioxide, all of that stuff that's the waste products of your tissue, then dumps into small capillaries, which then dumps into a major vein called the inferior vena cava. The inferior vena cava then takes all of the blood that's circulated through your body back up towards your lungs, and then there's a air fluid like transfusion where all of those things basically dump into the lungs and you breathe them out. That's why you breathe out CO2, because it's pretty much the waste products, right? So for her, the mass was so large that it was laying, and this is the first time I've seen this, but it was laying on her inferior vena cava, and what that caused it to do is to release fluid out of it, because when you press it, you're basically constricting that vessel, and then there could be a leakage of fluid that comes out. So what she had was this leakage of fluid that was not only just in her abdomen, but that fluid had collected into her right lung. And it was so much fluid. like when we, she had to get this drained multiple times, which you had 6 or 7 times in over a year of draining it, because that fluid would just recollect, and then they would drain it and then it would come back. So they thought it was a cancer, because like nothing really responds like this. You don't really have this normally where fluid in a healthy person is just coming into their lungs. They really just thought it was cancer. So when the final time before surgery came, she had her fluid drained off of her lung. They had drained 2 liters, and they basically told her that she couldn't fly, that she would have to cancel surgery, couldn't fly up at that point.
Ooh.
Danielle said, y'all, uh, no, hell no, we
Mhm.
ain't doing that. So this woman, this brave, courageous woman, I gotta big you up. I gotta talk that stuff about you, because you're so dope to me. But and your husband, because he is like was right there the entire way. He is like so awesome too. But they said, this is where we have to go. This is what we have to do. No matter what, it's got to happen. And they drove. They drove from VA, because they couldn't fly because of this fluid on her lungs, and drove up here. And then so when she got here, it was now it was my fight to get all of the people on board. Hold on, let me pick up my mom. Hey, mom, I'm on live. Come in here and say hi to the people. I'm on live with everybody. Come in here, stick your head in there. Hello, good people. That's my mom.
Hello.
Hey. How y'all
Oh,
doing? It's cold as heck outside.
yeah.
I'm in my son's game. But all right, mom. I'll talk to y'all later. All right. So, all right, bro. Yeah. So when they got here, and that was the next big issue, or the big step that I had, because as much as I wanted to help her, um, people are scared of tough cases, and that's where our women, like where you guys are having the problems, because even if there's one person that may be courageous, now I have to convince the anesthesiologist, now I have to convince all of the other hospital, I had to convince the pulmonologist that this isn't a cancer, that she needs to get drained so this could happen. I had to convince every other person on the staff that basically said, no, you can't do this, no, you can't do this. I had to fight for 2 days with people. First, I had to fight with the pulmonologist to say, drain her lungs. Well, no, it's going to cause this, it's going to cause this. I'm like, it doesn't matter what you say, but if you don't drain it, she's going to keep accumulating this stuff, and it's going to kill her. Like, you have to drain it. We have to do this surgery. There's absolutely no other options we have but to do this damn surgery. So everybody get out of yourself, and let's look at this woman who's come to us for help and make this happen. Like, it was so many issues that I had to deal with, of people and their own feelings and their own things, and people don't want to take the risk, which I understand. But at the end of the day, you know, we have a living human being that needs help, that uh we forget about. So I finally got them to drain her lungs, uh and it's legit. They drained out 2 liters, 2 full liters. So if you think a big Pepsi bottle liter, right? 2 of those. And that was just that. And then they put a chest tube in the next day, drained out another liter on top of it. So 3 total liters before we could even get back to surgery. Um, and then I finally got an anesthesiologist to get on board to do the surgery. And then so when we did the surgery, and what I was doing, I was like, in all transparency, I'll tell y'all how it went. So
Don't worry, Doctor.
so so usually when I perform these surgeries, I have it's a method to the madness. I never know what it's going to be when I get in there. Like, I have to actually see what it is first, and then I'll make my plan after. Because a lot of you guys will be like, well, do you need the fifth MRI or the fifth ultrasound? I got to get another one. You got to see, how are you doing this? You haven't seen this or whatever. Let me tell y'all something. None of that shit matters, because I it doesn't help me. I cannot figure it out until I actually look in there and see what the hell is going on. And I wasn't ready. When they said he wasn't ready, I wasn't ready. So when I got in there, it the mass was stuck to everything. It was stuck to her top of her belly. It was stuck to, well, the uterus, of course, but then it was stuck to the back in her bowels or whatever. So I had to figure it out. And the most challenging thing is that it just everything had a blood supply. Every single thing had a blood supply. Usually, when I have like
Mhm.
when you have a big mass like that, it's pedunculated, and once I get the blood supply, I'm good. Not her case.
Uh-uh.
Not her case. So it had a big pedunculated or big stalk that was feeding it from the uterus, and then once I got that in my mind, I was like, "Oh, I'm good." You're not good. We're not good here. So like I got that, and the key, the magic for how I do it through these little incisions or what have you is like I have to like maneuver it around, pull it and chunk it out. Usually once you get the blood supply and you start chunking it, like the bleeding is pretty much done. That's not the case. And somebody just asked how many fibroids. That big thing that you saw that was next, that was after her before picture, that was one fibroid. One single solitary fibroid, probably over 100 centimeters worth of fibroid, right? There was just one stalked fibroid. And the couple of things that were just really, really challenging was that as I was cutting into the fibroid, which at that point should not have a blood supply, it was bleeding vigorously. Like there was just blood pouring from this large mass, uh, which was challenging. At a certain point, I just had to actually like stick my finger in a hole and just like close my eyes for a second and just start thinking, because it was like a point where I just was like, hey, you gotta figure this out. So it took me there. And then once I finally got all of this fibroid almost out, the surprise or the shocker was that the fibroid had actually commandeered its blood supply from her bowel. So like a large section of her fibroid had connected to her bowel and was draining the blood from her bowel and was feeding itself from her bowel. So that's where it got kind of tricky, to where now I had to call general surgery, and because I couldn't save that portion of her bowel, and there had to be a small resection of that portion of her bowel. But all in all, we got through it. And they were asking how long was it? I think it's in there 7 hours. Yeah, probably like 6 or 7 hours.
Yep.
Yeah, roughly about six or
Oh,
7 hours for this surgery with general surgery. Um, but that was it. And then it was, to that point, because they had to do a bowel resection, we had to leave we had to leave her abdomen open for a few days. We wanted to let things drain to reduce the risk of infection, put a wound vac in, and then came back in, washed everything out, and closed her after 2 days. 2 days, was it, Daniel? 2 days when we come back and close.
the surgery was Wednesday, Friday. They
It
came back
was either
Friday
two or
morning.
yeah, it was like either 2 days, 2 or 3 days, when we came back close. But that was it. But to be able to get that mass through that incision, was just an amazing thing. And that's just not it's just everybody, my residents and everything, everybody. It was a whole team full of people. It was 19.9 pounds to be exact. Everybody was asking what the weight was. It was 19.9 pounds of a mass, to have removed. But to that point, like, I wanted you guys to meet Danielle, to understand that it's real people, it's real women, and mostly Black women that are suffering from this. And to your credit, don't ever, like, please think before you guys say some of these things, like, saying like, when is your baby due, or she got to be pregnant, or she had to be doing something, like, why in the world would she let it get this long? Because the only difference between her and you is that she had a rapid growth of her fibroids. Your fibroids just didn't grow that fast. But if those fibroids grow quickly on you, you very quickly find yourself in a predicament where you don't have anyone that's going to care for you, and no one's going to save your uterus. No one's going to give you the opportunity to have a surgery that's going to be, a minimally invasive, and not worry about, your recovery, your pain, everything else that comes from it. So be very cautious and sensitive with women that are going through this, because it could be you, very easily could be you. And also to just, it's almost like when people like fat shame or anything else, and like say it's like it got to be her fault. She got to be doing something. She got to be eating bad. She got to,
Mm-hmm.
she got to be doing. She didn't do anything. This woman ate healthy,
Mm-hmm.
and small, super small.
Yes.
What we right? This woman is small,
Well,
right?
yeah.
What's our normal weight is like what, 115, 120,
No, like 130.
130? Are you
Yeah,
you've been
no,
eating?
because
You've been
I'm
eating.
tall. I'm tall. No, y'all. No, I'm gaining weight, but I had become like skeletal. I could not keep my weight because of this fibroid. Like Dr. P was saying, it was attached. It was getting blood supply from my small bowel. So I just had a host of issues. I don't see her on the line, but Coach Jessie of the Detox Now, that's how I found Dr. P.
Yeah,
Just following
sure.
her on Instagram. She is a good resource of information if you all are looking for information about fibroids. But I am just blessed to have been able to find you, Dr. P. Whew, my life
So,
was, it
so were they
was rough.
intramural or submucosal? They were the big one was not even it didn't even really touch her uterus. I mean, it was stalked off of her uterus, but it was subserosal, if you want to talk about it. It's pedunculated. So it wasn't really her uterus was normal and small. Like, but the fibroid had branched off and had a life of
Mm,
its own. It had taken over her blood supply. And, it started to really take her nutrients to where she was, starting to waste and muscle waste, just because
yeah,
it was taking up everything, to live. So,
yeah.
in answer to that question, yeah. So, so they said, can you stand up to see how you look
Oh,
now? So they
oh
had the
my
before pictures.
gosh. Yes, you are. Oh, this dress. This used to be my favorite dress. I could not wear it for years. I used to look at it and be hurt. Well, hold on, you all. I got to move my thing back. Hopefully. Wait a minute. Can you all see?
Look at Skinny Minnie.
Yeah,
Look
y'all,
at Skinny
I'm
Man.
not even a big person. And you see, I
Look at Skinny
got
Man.
button it.
Look
Can you all see me?
at Skinny Man out there.
Y'all,
Yeah, it's up a little bit higher. They can't see. They can't see. Lower it a little bit.
wait a minute. Hold on. Wait a minute. Wait a minute. I gotta. Wait a minute. Wait a minute. All right. Can
There
you
you
all?
go.
There we go.
Look at her.
Yeah, I've
That's amazing.
been big
That,
in general.
that's amazing. That's amazing.
Yeah.
I'm just looking because I remember our first consult, and when you was like you stood up, and I was like, "Show me your belly." It was just like, "Oh my goodness." J- it's so awesome. That's awesome to see. Hold up, you hit the button. I think you hit the audio button. There you go. You came back. Yeah,
Yeah,
you came
but
back.
yeah.
You
And it's
look
really,
absolutely amazing.
yeah, and I know I was seeing in the comments, people was thinking I needed a tummy tuck. I don't
Mm-mm.
need a tummy tuck. I
No,
don't even have stretch marks, y'all.
no.
I don't even know how that happened. It's like, no, I do. Shea butter and olive oil. But
They said,
but
how you feeling now?
good overall. This is the first week where I'm like, okay, I'm going to, normal life is not too far away, because
Yeah,
mine was a little extra with the surgery between having the resection, Goodness, the surgery itself. How long was I in the hospital? I think I was in the hospital 6 days,
Yeah,
give or
I think
take.
it was 6 days.
Yeah,
And a lot of that was precautionary too. I mean, because she had the
yes,
lung issues, they were scared about reinflation of her lungs and damage to her lungs and causing, insufflation problems. So she spent some time in the ICU, but never did she decompensate or anything. It's amazing when you get 20 pounds of fibroid lifted off of your inferior vena cava, it stops producing
yeah,
fluid. Like I was telling them, like I promise you she's gonna be good. Y'all let me get
yeah.
the shit off of her, she's gonna be fine.
Remember, they left me on the ventilator. Oh my God. Yes. Yeah. So I was able to breathe, you all, to get off the ventilator. So it's since then, as far as my breathing, no problems there whatsoever. Yeah. So Dr.
It's
P, yeah,
amazing.
that's where I say you saved my life in that regard.
My
Because
pleasure.
I just, yeah, that at that point, and that's where Dr. P was saying we drove 11 hours, you all, because
So
I
they
said,
asked when was the surgery? So yeah, so that's a good question. When was
oh,
it?
when
Tell
was
them the
the
date.
surgery? I had the surgery February 7th,
Right. So February 7th, we are what, March 14th.
18th.
This is how she looks. Are you in any pain or like what are you feeling like? What's your day-to-day life looking like?
My day-to-day life, for the most part, I mean, I can drive. I don't drive far, because now if I push myself too much, I'm like, whew, I'm beat or whatever. But I can move around, walk around. It's not um any I feel so much lighter, where that's where I think that probably makes the difference for me. But I can do my own thing, if I need to make myself something to eat, I can do that. So I'm pretty much getting back to regular life. It's just as far as the pain, um I'm not on pain medication anymore. I know Dr. P, he makes sure you be like, if you don't want to be on drugs, Dr. P, definitely you're not going to be on the drugs. Yeah. Yeah, so um in that regard, I was on the pain medication probably for about like the first